Hello, everyone. So we're back ending our tour now with the Chiropody program. So I'm going to hand things over to our faculty member here to tell you about it.
Hi, my name is Mira. I'm a chiropodist and a professor here at the Chiropody program at Michener Institute. This program is a 3-year program. What's unique about our program is we have a teaching clinic as well on site. So the students get the didactic training as well as the clinical training at Michener in the first 2 years. And it enables us to incorporate the practical skills with the didactic knowledge that's being covered at the lectures. And the program itself is 3 years long. In the first year they have 2 semesters. In the second year they have 3 semesters, including a summer semester. And then in the final year they have 2 semesters. And the final year is focused on externships, so they rotate through the community in hospitals or community health center settings as well as private practice settings. We are the chiropodists are primary care practitioners, and so we have the ability to set up our own practice or work in a hospital or a community health center setting, which gives us a lot of choices as well as a variety of experience and scope. As chiropodists, we treat the foot distal to the ankle. We can address conditions that are related to biomechanical deformities, to dermatological conditions, to other systemic complications like diabetic ulcers, diabetic wounds, and infections. Okay. So we have some displays here today. Some of the students here are practicing taping techniques, which is one of the courses we offer, part of the sports medicine program. So Wendy here is doing a low dye taping and in the sports medicine we teach, in addition to assessment of the lower extremity, we also teach different modalities as well, as such as ultrasound, laser, shock wave, TENS, things like that. And it's those techniques and skills are transferable. It's not exclusive to sports medicine. It can be used as well in other podiatric conditions as well. Over here, the students are practicing biomechanical assessment. This is important to address any kind of gait disorders, biomechanical disorders, and they do these assessments to understand what the problem is, and then based on that we can prescribe a treatment plan, which can include orthotics as well. Before prescribing orthotics, they will have to also do gait analysis and other assessments as well. Before our students go into clinic, we focus a lot on lab training on simulated environment. So here, this is a tool that we use to teach suturing techniques. So Rabi here is performing a suture technique, and these are like simulated skin, and so they can practice in a safe environment, and once they become proficient at it, they can practice that or perform these procedures in patients in the clinic downstairs. Over here we have a couple of first-year students. They are doing some basic assessment of the foot. So Nicole is doing a Doppler assessment to listen to the circulation in the foot, and you can hear that there. But we can do neurological assessment, musculoskeletal assessment, dermatological assessment, as well as vascular assessment, which is routinely done when we see a patient down in the clinic. And if there's additional or more intensive assessments that are needed, then we can do them appropriately. Okay.
Just a quick question for some of you guys. Can you tell us about something that you found interesting or unique that you weren't prepared to experience about this program or Michener, just working in healthcare in general?
What I found very unique was the fact that we get a lot of practical experience. We learn a lot of didactic knowledge, and then we're able to translate some of that knowledge in the clinic or at our cadaver labs, and it's quite practical. You learn a lot.
Great. I think that concludes our tour. Thanks for joining us with our Facebook Live tours today. It's been great, and we hope you come back and check out the Michener Institute.